So a common question we often hear, especially when kids are starting OT, is it sensory or is it behavior? And I think this is a conversation that happens a lot in schools as well. So teachers or educators are concerned if whether the child is intentionally doing something, so if it's a more behavioral idea or route, or if the behavior is sensory related. And I think as OTs trained with the DIR lens, we would argue that almost all behavior is rooted in something other than intentional behavior. So yes, there are ways that kids kind of test boundaries or limits to learn about the world, and that's a really important way of learning about the world. However, when we see behavior in the clinic, it's often not that, or maybe it is sometimes. But our role as OTs and people supporting these kids throughout their day is to look below the behavior and see the sensory signals or other signals that may be there and maybe help for us to learn and support and guide through it. So a few examples I'll give in how sensory signals can present as behavior is if a child is always moving. So the parents want them to sit still, the teachers want them to sit still, but the child's just not able to sit still. Maybe they're having difficulty organizing their postural system or senses in that way, in a meaningful way for them to sit still in a chair. So that's one example. Another example might be that they are hitting or pushing impulsively or with a more reactive way. And we may look at that as maybe a child is feeling over responsive to tactile input. So if somebody moves close to them, they're a little bit on edge, they feel safe, and they're protecting because they feel like there is a threat. So there's always different ways to look at the simple behaviors that we see. Another example is if a child isn't using eye contact. They could be trying to shut out visual information as a way to open up auditory information and listen more deeply to the people around them. Or maybe they're shutting out that visual information because it opens up more sensory resources or more resources in their nervous system to get them back to a comfortable threshold and still orient their body to what is going on, or to, again, listen to what is happening in the environment or with the others around them. Another example may be if a child is getting silly all of a sudden. So this is something we see all of the time. And silliness is a big sign of what we call dysregulation. So if a child is silly and it doesn't match the situation, so there's not really anything funny going on, maybe it's time to leave and suddenly they're giggling and moving around, and it's indicating something other than this is funny. So there's a mismatch between what's happening at the time and what the child's experience is emotionally. So what we're thinking about in that moment is there another emotional sensation in their body that they're having difficulty making meaning of, and it's coming out in this silly way? So we're thinking about maybe they have fear of what is to come next, or maybe they are a little bit sad about leaving and they just had a really good session. So maybe there's some other negative emotional experience, negative quote, that's happening that they're having difficulty modulating in the moment in a way that they can create a functional adaptive outcome. So these are a few ideas of different ways that sensory signals can present as behavior. So we always want to think more deeply and really be detective in this role. And it's our role to get to know kids individually, because every child is so unique and really needs advocates for them in interpreting these signals, especially a lot of the kids that we work with that have vulnerabilities in their nervous system, and their signals may be more challenging to read. So that is all for this topic, and I hope it is helpful.